Okay, we will go ahead and get started. And as a matter of housekeeping, I want to make sure everyone knows that CART and ASL are available. To utilize CART, go to captions, and to utilize ASL, please go to the ASL button under interpretation. And if you have any questions regarding that, please do let us know. But I hope that you can make it available or make yourself welcome in this webinar by using those tools at your disposal. So with that, welcome everyone. My name is Kari Benson. I'm the Deputy Assistant Secretary for Aging at the Administration on Aging, housed within ACL. So pleased to have you all with us here today for our next series of Back to Basics webinars. This is in fact our third in this series of webinars that we are calling Back to Basics as a part of our technical assistance efforts to support and really work alongside all of you in the Aging Services Network to implement the updated 2024 Older Americans Act final rule. And so we are excited to have today the webinar focused on Title III and Title VI coordination. We have been hearing from many of you that you are eager to hear the details regarding the new Older Americans Act rule, and we're delighted to share that this webinar is going to cover many of the details related to serving American Indian, Alaskan Native, and Native Hawaiians in Older Americans Act programs under both Title III and Title VI of the Older Americans Act. We welcome all tribal leaders and representatives who are joining us today, and we welcome all of you in the Aging Network who serve Native American elders and family caregivers, whether on the Title VI side or the Title III side, or maybe both. We also know that it's really important as we work together in implementing the 2024 Older Americans Act final rule to really bring together the program, fiscal, reporting, and other components of our Older Americans Act program administration at the State Unit on Aging level, at the area agencies, also within the tribes, at the ombudsman, service provider, and other levels. And so we're really hoping that you continue to bring together your colleagues in accessing these webinars, but also working through the overall implementation process. So whether your colleagues are able to join you here today for the live webinar, or and if not, they will be able to access the recorded version. We're hoping that everyone will be able to benefit from the overall webinar series, but of course, particularly our session today. So our webinar today, like I said, critical information will be shared for both tribal and aging services leaders. Title VI of the Older Americans Act authorizes grants for nutrition and supportive services to American Indian, Alaskan Native, and Native Hawaiian elders to help them live full lives in their communities, and grants for services to support their family caregivers. Title III of the Older Americans Act authorizes grants to state units on aging and area agencies for supportive nutrition, health promotion, and family caregiver services for eligible older adults and family caregivers, including tribal elders and family caregivers. Title III services are to be provided to those in greatest economic need and greatest social need, the definition of which includes Native American identity. In our first Back to Basics webinar, we discussed key aspects of proper stewardship and program management, including the importance of achieving a balanced and collaborative approach. The webinar briefly reviewed the Older Americans Act final rule and explored how to make appropriate updates for implementation, including advocacy, program monitoring, fiscal oversight, and data collection considerations. The second Back to Basics webinar further discussed the fiscal aspects of policies and procedures, emphasizing that fiscal policies and procedures must work in coordination with program, reporting, information technology, and other aspects of Older Americans Act program administration. Our intent with the Older Americans Act rule and with today's webinar, the third in our series, is to give clear information that is grouped together in a way that facilitates clear understanding of the unique requirements of the Older Americans Act. And now let's dive in. We'll go to the next slide. And I'll just provide you a brief overview of our agenda today. We will first cover brief background information, including on the Older Americans Act regulations. And then we're really going to dive in and review selected rule provisions, especially those that are applicable to coordination between the Title III program and the Title VI program, and summarize key points and provide links for you to additional resources. So we'll talk about the Title III and Title VI coordination throughout this webinar, but we're also going to talk about responsibilities for serving Native Americans that apply to all Title III programs, even those operating in parts of the United States that may not have a Title VI funded program. So this webinar really covers all of us across the country and how are we serving Native American elders as well as their family caregivers. So with that, I am pleased to turn the presentation over to Cynthia LaCounte, Director of the Office of American Indian, Alaska Native, Native Hawaiian Programs within the Administration on Aging at ACL.
Thank you, Kari. Thank you very much. This is, and welcome to everyone in the Aging Network. This is very exciting to have this webinar and to be talking back to basics. We've been wanting to in the Title VI world, we've been really excited about this for a long time. I have been working, my name is Cynthia LaCounte. I'm a member of the Turtle Mountain Band of Pembina Indians, enrolled in North Dakota, grew up in Montana. And I have been in my position for 12 years as a federal employee. However, I have worked with Title VI programs, and at the beginning of my career, I was actually a AAA director for tribes in Montana. So I've worked with both Title III and Title VI for a number of years and am really excited about joining this webinar. Let me see my next slide here. Of course, my computer isn't doing exactly what I want it to do. We're excited that so many of you here from all parts of the Aging Network are on today's call. For those of you who aren't familiar with working with tribal elders, tribes, and even the Title VI program, I'd like to share a few facts to help us all get oriented to our Title VI world. First on this slide is projected number of older American Indians and Alaska Natives by the year 2030, excuse me. At almost 450,000 people, this represents a nearly 50% increase over the 2019 population. So we are increasing, our aged population is increasing about at the same capacity as it is in the general population. We'll talk more about the Title VI of the Older Americans Act throughout this presentation. Title VI was added to the Older Americans Act in 1978, and we funded our first programs in 1980. So we've really been around for quite a while. And we have now stretched from our 1978 programs, we've expanded about 4 times what we funded at that time. Title VI of the Older Americans Act provides essentially the same services as Title III does. It provides nutrition and supportive services. Title VI of the Act is awarded to specifically meet the needs of the older American Indians, the Alaska Natives, and Native Hawaiian populations who were not being adequately served through Title III services. So Title VI came along to kind of fill in that gap. There's a great diversity. There's a lot of diversity in our programs. And what we try to do in Title VI, or what we do in Title VI, is definitely respect individual cultures. There are 574 federally recognized tribes across the country. That means there's 574 different tribes, different languages, and different customs across the country. So in Title VI, we allow tribes to pattern these programs and kind of take the skeleton of the program to develop into a program that's truly going to be responsive to the needs in their own communities. As I said, we serve 291 grantees currently under 2024 under Title VI. However, don't stop at 291. That actually expands to over 400 of the 574 federally recognized tribes. To participate in Title VI, a tribe must have a minimum of 50 seniors, 60 years of age and older to be eligible. And as some of you know, we have some very small tribes and Alaska villages scattered around. So some of them can't meet that eligibility criteria and form consortiums. So that's how we expand from 291 grantees into, I think it's 409 actual tribes that we're working with. So that's pretty exciting. That's exciting in our world for certain. I have lost my notes once more. Some state and AAA folks on this webinar I want to mention might say that, well, you don't have tribes in your state, or you don't have tribes in your geographical area. And we want to talk, we're going to address that this afternoon too, because the requirement is not just to serve tribes or to serve Title VI programs, participate in Title VI. The actual requirement is to work to provide services to American Indians. And as I said, many of us live in urban areas. Going into the next slide, I believe. We also have family caregiver programs in Title VI, and those programs are also served under these Title VI grants. Now you look at this slide with a beautiful map of our United States of America, and you'll see numbers across states. These numbers represent the number of Title VI funded programs within each state. My home state of Montana has 7 Title VI programs. California has 35. Alaska has 48. And let me remind you that we don't have tribes in Alaska. We have villages and consortiums in Alaska. Then you look kind of on the right-hand side of this map, and there's gray areas with no numbers. Does that mean that there's no Indians to serve in those states? As my mother would say, oh heavens no, Cynthia. That means that while there may not be any reservations in those states, there are still American Indians living within those states, and probably predominantly in urban areas. So where there are not Title VI programs, accessing Title III or coordinating with Title III is really the easy way to provide services to tribal elders. It's more complicated in those states without reservations, because our partners may well be the Indian Health or tribally health funded urban health facility. There's 42 of those across the country, or it may simply be a community organization within the urban area that we would be working with. And my office is just the place to help us find out who those contact information or where that contact information would be. On to the next slide, if we may. Our beautiful slide of the Older Indians website. We're really proud of our website, and we want to invite you all to come in and check us out. This website, Older Indians website, has been developed specifically for Title VI programs, and it's their resource information. There's a link on here that's highlighted that shows how you can find the Title VI directors in your area, in your state. And certainly come into our website, investigate our website and check it out, because there's a lot of information we post. Not only is it an access point to reach the Title VI directors in your area or in your state, but we also list all of our training events, all of our technical assistance, past training events, past consultations. There's a lot of information on this website, and we're launching a brand new one tomorrow. It's supposed to be launched at 11 a.m. So don't look today, wait and look tomorrow and see what we've put on the website, because it'll be fantastic. Let's see, where are we? The path to the final regulations. This has been a long, winding trail as we've been working on these regulations. In 2022, we issued the formal request for information and started conducting listening sessions, which included formal tribal consultations and meetings with all of our Title VI grantees. We have a very open dialogue and communication with those with those tribes grantees. So we were dropping the hints that we were starting this process. In 2023, we ACL engaged in official tribal consultation at the Title VI conference. We issued our formal notice of proposed rulemaking. We held tribal consultation sessions regarding the proposed rule, and we received comments from over 750 entities as a result of the notice of proposed rule and from tribal comments. We did hold more than one consultation session. In 2024, as you all know, we published the final rule. We held another tribal consultation session in March here in Washington, D.C. during the Title VI conference. We have been providing training and technical assistance to our Title VI programs, and we are beginning to look at our templates for policies and procedures and some of the work we're going to need to do on our side to help facilitate this thoughtful collaboration and coordination. So now I get to turn it over to Mr. Derek Lee, our regional director out of Region 6 out of Dallas. But first, I want to thank you all for your very thoughtful and your detailed input to support our National Aging Network, the Native American elders, and the family caregivers that we serve. All of those 750 comments definitely did not come from Indian country. They were also from folks like you concerned about serving the tribal elders. So thank you for that. I'm going off screen. And go ahead, Derek. Thank you.
Thank you, Cynthia LaCounte, for that background. Yes, I'm Derek Lee. I'm the regional administrator for ACL in the Dallas regional office. And I've had the good fortune to work with all the programs under the Older Americans Act, and in particular, the Title III and VI programs that we will focus on today. And we'll begin with just an overview of our federal statute, which is the Older Americans Act of 1965. And of course, this authorizes and funds our home and community-based services. The Older Americans Act gets updated or reauthorized, as we say, approximately every 5 years or so, with the intent of keeping it current, keeping it applicable to the changing and evolving needs of older adults and family caregivers. The Older Americans Act provides for a range of services and supports for older individuals, including meals, which is undoubtedly our most visible program, but the Act also provides for transportation, health promotion and disease prevention, in-home supports and personal care, and also legal assistance. The Older Americans Act provides supports for family caregivers, where we target caregivers of older persons, and also a group we call older relative caregivers, and this is often grandparents caring for grandchildren. The sections of the Older Americans Act most relevant to our discussion today are Title III, which provides funding for states and their agencies on aging, AAAs. Now, the Older Americans Act requires ACL and AOA within ACL to distribute funds to state units on aging, SUAs. The states are required to distribute those Title III funds to their AAAs using an intrastate funding formula. The AAAs, their agencies on aging, then provide funds to and work with local providers and contractors. Now, in the few states that don't have AAAs, those state units on aging have an allocation plan to distribute funds directly to local providers and contractors. And please be aware that Title III funding is to provide services to all older adults and caregivers as funding allows. And this includes Native American elders and their caregivers. The Older Americans Act also includes Title VI, a dedicated Native American section that funds services exclusively for Native Americans, including Alaskan Natives and Native Hawaiians. Now, the services provided in Title VI are practically identical to those in Title III that we fund the states and the AAAs with. And as you heard Cynthia note a few seconds ago, Title VI is a relatively newer portion of the Act, which was put into the Act in 1978. The Older Americans Act also has an elder rights section, which is Title VII. And this includes the long-term care ombudsman program, serving individuals who are living in long-term care facilities. It also has provisions for the prevention of elder abuse, neglect, and exploitation. The federal law, the Older Americans Act, has required coordination between the two programs, Title III and Title VI, for many years through several reauthorizations. And here in the Older Americans Act, we have those requirements for coordination between Title III and Title VI. As you see here, Section 614 of Title VI is for Title VI grantees, and it outlines their responsibilities for coordination with Title III. Section 306 of Title III is for AAAs, their agencies on aging, and it outlines the requirements for their area plans on aging to specify coordination with Title VI. And Section 307 is for state units on aging, and it outlines the state's requirements for state plans on aging to specify coordination with Title VI. And in the final rule, the final regulation, we specify that coordination is the responsibility of both programs, and it is required of all parties, tribes and tribal organizations, AAAs, and state units on aging. So you'll see ACL emphasizing many of these points in upcoming presentations to various audiences, and they are, of course, in this presentation for our easy reference. Now, ACL is required by the Older Americans Act to distribute the federal dollars to a state based on its proportional population of older individuals as compared to all the other states. And this older population in a state includes the age 60 plus American Indian, Alaskan Native, and Native Hawaiian elders. As required by the Older Americans Act, each state must implement Title III and Title VI coordination efforts. And we'll talk more in detail about what coordination with Title VI program means in just a few minutes. Now, additionally, states, including those that have no Title VI grantees within their borders, have the responsibilities in their state plan assurances to increase access by Native Americans to all aging programs and benefits, and to specify how the state will do that. And this includes, as we said earlier, states that have no reservation lands. It might include areas within the state that have large urban Indian populations, or might include tribes who have not applied for Title VI funding. One of the hallmarks of the Older Americans Act is that it is up to individual states and AAAs to best meet the needs and coordinate the resources that exist in their specific communities. That's something we especially highlight and focus on in the Older Americans Act final regulation. We want to ensure that Older Americans Act services and programs meet the needs of Native American elders and caregivers specific to their local circumstances. So coordination between the two programs has been required through several reauthorizations of the Older Americans Act, as we mentioned earlier. So what's different with the new regulations? Now, the Older Americans Act has had accompanying regulations, but those regulations had not been updated since 1988. So we've had about 5 Older Americans Act reauthorizations, but our regulations had not been updated. And in these intervening almost 40 years since the regulations were last updated, of course, there have been many changes. The population of older adults, very fortunately, are living longer than they ever have before. That population has nearly doubled. Also, attitudes about aging have changed. Expectations for aging have shifted. Yet one important thing has not changed. Older adults overwhelmingly want to continue to live independently in the community and in their homes. And fortunately, nearly 95% of them do that. So besides the general common sense need to having modern up-to-date rules, these new regulations, as you see here, better align with the current statute. We've had several updated versions or reauthorizations of the federal law, but the rules for day-to-day implementation had not been updated. The new regulations reflect the needs of today's older adults. As we said a second ago, generations change, needs change based on progress in healthcare, policy, technology, what have you. Very importantly for us, the new regulations give better clarity in practicing appropriate stewardship of Older Americans Act resources. The new regulations clarify and better define programmatic requirements and support the aging network with the ultimate goal of improving program implementation to better serve older adults and caregivers. As we get into some details now, it's important to remember that the vast majority of what's included in the final rule are long-established Older Americans Act requirements, reaffirming what is in statute, prior regulations, or existing policies, rather than new requirements. This new rule doesn't change the federal law, but it does provide for more clarity, more consistency in the way we deliver our services, as we've said. So again, the new rule gives clear definitions and clarifies service requirements and the use of funds. The Older Americans Act final rule became effective a couple of months ago, March 15th, 2024. And of course, ACL will provide robust training and technical assistance, and we'll work with states and Title VI grantees to come into compliance. And this Back to Basics webinar here is just one of the ways we are doing that. Now, AAAs, Area Agencies on Aging, should work closely with their state units on aging. And likewise, service providers should work closely with their AAAs or with the state for those single PSA states. The compliance date is October 1, 2025. However, as we referenced on the previous slide, much of what is in the final rule are long-established Older Americans Act requirements, reaffirming what is in statute, prior regulations, or existing policies, rather than new requirements. So with that background, now we'll discuss a brief overview of the final rule and dive into specific provisions of the final rule. As we've mentioned, the final rule covers Title III, Title VI, and Title VII. So there is a lot of information to cover. As a Word document, it's about 460 pages. And of course, we'll break that into pieces today. Over the coming months, we plan various trainings and technical assistance activities to help the aging network digest what's in the final rule and to help digest it into more manageable bites. So at a high level, this final rule can be broken into 2 parts. The first portion is the preamble. Now, this preamble provides background information. It explains the various provisions of the rule. It describes the comments received from the public and stakeholders and our responses to those. And it gives information on required regulatory analyses. This preamble is about 2/3 of the total document. The second portion is the final regulatory text in full for Title III, which is 1321 in the new regs, Title VI, which is 1322 in the new regs, and Title VII, which is 1324 in the new regs. For your reference, here are selected parts of the new regulations that are applicable to coordination between Title III and VI. Now, we'll talk more in detail about this in the coming slides. One important point to note is that we did take care to specify expectations for both Title VI and Title III in the final rule, while respecting the unique ways these programs are structured in the Act, as well as in local communities across the United States. So for Part 1321 in the new regulations, which contains the Title III requirements, there is applicable language for state and area agencies on aging, including around state plans and area plans on aging, interstate funding formulas, and public input. We specify requirements for service providers under Title III, like meal sites, transportation programs, or respite providers. And we also detail coordination expectations around emergency and disaster situations. Similarly, for Part 1322, which contains the Title VI requirements, there's language for Title VI funded tribes and tribal organizations specific to coordination with Title III funded programs and also around emergency and disaster situations. As mentioned, our focus this afternoon is on coordination between Title III programs with states and AAAs and the Title VI Native American program. Though there are new specific requirements for coordination in the new regulations, be mindful that the requirements for this type of coordination have been spelled out in the federal statute for many years, as we said earlier. So why is this important? Overall, coordination will have great benefits for you, your programs, and most importantly, for the elders and caregivers you serve. Coordination, as you see here, increases your knowledge about available programs. It leads to better access to additional services for elders. Coordination leads to greater efficiency and reduces duplication. Coordination increases community support, could lead to increased funding opportunities. And coordination gives access to more information. It helps you to address needs in a more comprehensive, holistic way and in a culturally competent manner. As we said earlier, in the new regulations, Section 1321 is directed to state and local programs. So going into some details, we'll start with the content of the state plan as specified in Section 1321.27 of the new regs. We stated earlier that state units on aging must have approved state plans on aging to receive Older Americans Act Title III and Title VII funds. The new regulation specifies that the state plan on aging must include a description of how greatest economic need and greatest social need are determined and addressed, including methods to address populations the state may prioritize. We note that the definitions section at 1321.3 includes definitions for greatest economic need and greatest social need that the states and the AAAs must follow. In particular, the definition of greatest social need includes cultural, social, and geographic isolation due to Native American identity. State plan must also include the interstate funding formula, the IFF, which shows how Title III funds are distributed to their AAAs, who then further provide grants or contracts to local community-based organizations to provide the services. Now, in the handful of states and territories without AAAs, the state has a funds distribution plan for how that state will work with local community-based organizations to actually provide those services. Additionally, the state plan must demonstrate that the determination of greatest economic need and greatest social needs specific to Native American persons is identified in communication with tribes, tribal organizations, and Native communities. Must demonstrate that the Title III and Title VI services will be coordinated and that the state will require its AAAs to provide outreach to Native Americans, including those living outside of reservations and other tribal lands. As part of the state plan development and submission process to ACL, the State Unit on Aging is required to have a public participation process that's further outlined in a following section at 1321.29. Now, we'll go into more detail on state and area plans on aging in our next Back to Basics webinar, which is scheduled for June 27th at 2 p.m. Eastern. Okay, moving on, 1321.53. The rule includes a provision on expectations for states and their Title III and VI coordination responsibilities. The new regulation is specific in that it requires states to have policies and procedures that explain how the state aging network will coordinate with Title VI. This must be developed with the relevant Title VI program director. And states may also wish to meet this requirement through a state-specific tribal consultation policy that includes Title VI programs. So it just can't be said that there will be coordination, or it just can't be assumed there will be coordination. The state is required to spell that process out, as you see here. Now, the rule is specific in what the policies and procedures must address. The policies and procedures must include outreach and communication to tribes about Title III and other funding opportunities. Must include technical assistance on how to apply for those funding opportunities, and must include information on meetings, email distribution lists, presentations, public hearings, what have you. The policies and procedures must also include methods for collaboration on and sharing of program information and possible changes. For example, maybe a congregate nutrition site is changing its service hours, or an evidence-based prevention program is starting a new program. The policies and procedures must address how Title VI programs may refer individuals for services funded by Title III or Title VII. Again, for example, how the Title VI program might refer someone for ombudsman services funded by Title VII, or for transportation or legal services under Title III. The policies and procedures must address how services will be provided in a culturally appropriate and trauma-informed manner, recognizing that these policies and procedures must be developed in coordination with all entities to best meet the needs of elders and family caregivers. For example, maybe the state provides a list of activities and events offered with consideration of culturally relevant observances. Policies and procedures must also address opportunities to serve on advisory councils, including those required of AAAs by the Older Marriages Act, as well as on work groups. For example, maybe the state has a caregiver services work group, or the state serving, for example, on the State Board on Aging. In other words, the state has a responsibility to ensure that Title VI programs are invited to participate in all state-sponsored events, things like statewide conferences, workshops, advisory council memberships, boards, and to ensure that local AAAs include Title VI programs in Older Marriages Act sponsored events, things like trainings, local activities, wherever possible or feasible. Okay, next we'll talk about AAA responsibilities. All AAAs, Area Agencies on Aging, are required by the Older Marriages Act and the final rule to have an advisory council. This advisory council's role is to, of course, advise on the area plan on aging, but also to represent the interests of older adults and caregivers. Also to review and comment on policies, programs, and actions affecting older adults and family caregivers. In these advisory councils, membership must be at least 50% older individuals, with efforts to include those identified as in greatest economic need and greatest social need. And the advisory councils may include others, including representatives from Indian tribes, Pueblos, or tribal aging programs. Again, it's important to note that it applies to all area agencies on aging, not just those in areas with Indian reservations, tribal lands, or Title VI funded programs. The final rule includes other important information on AAA advisory councils, and of course, we encourage you to review that section for more information. Just as states are required to have a state plan on aging, AAAs are required to submit an area plan on aging to the state in order to receive Title III funds. So the state unit on aging must have policies and procedures for those area plans. Those policies and procedures must include that the AAA will identify populations within their planning and service area that have the greatest economic need and the greatest social need. The area plan must include assessment and evaluation of unmet need for services in that planning and service area, regardless of funding source. The area plan must include how the AAA is proposing to use the Title III funds, including the description of services, the proposed number of people to be served, units of service, and expenditures. This information must include how the AAA will distribute funds within that planning and service area. And there must be an opportunity, of course, for public participation regarding that area plan. And of course, AAAs have specific responsibilities regarding coordination with Title VI programs. So here, 1321.69 in the new regulation is directed to AAA programs and their responsibilities. The AAAs have similar requirements to states. AAA's policies and procedures must explain how the AAA's network, including service providers, will coordinate with Title VI programs. These policies and procedures must provide for outreach, not only to the grantee organization, but to tribal elders and their caregivers. For example, in some communities, the AAA could come to the Title VI funded senior center on a regular basis. Like with the states, the AAA's policies and procedures must explain communication to tribes about funding opportunities and offer technical assistance on how to apply for those funding opportunities. They must also describe the methods for collaborating on and sharing of program information and possible changes. Policies and procedures must address how services will be provided in a culturally appropriate and trauma-informed manner, recognizing that these policies and procedures must be developed in coordination with all entities to best meet the needs of elders and family caregivers. And because AAAs work more closely with elders and caregivers than the states do, the AAA's policies and procedures must address how Title VI programs may make referrals for the tribal elders and caregivers who are eligible for Title III services. For example, if the Title VI program refers an elder for Title III transportation, it would be helpful if the AAA and the Title VI program have been in communication about maybe the routes that are available from the Title III program. How far in advance a ride needs to be scheduled, or maybe a phone number to call and a contact person for that transportation service. So the Title VI program is making an appropriate and full referral. Finally, policies and procedures must also address opportunities to serve on advisory councils, including those required of AAAs by the Older Americans Act, as well as work groups. For example, maybe the state or the AAA has a caregiver services work group, or possible state boards on aging, like we mentioned before. There's another section of the new rule that is directed to service providers, 1321.95, and it has very similar requirements. Throughout section 1321 of the rule, again, which are the requirements for Title III grants to states, AAAs, and providers, you see that there are requirements for coordination at all levels. So now we'll turn to section 1322, which have the requirements for Title VI grants to tribes and Native Hawaiian grantees. And here you will also see requirements for coordination. So yes, section 1322 of the new regulations is directed to grants to Indian, tribal, and Native Hawaiian grantees. As I mentioned, with the federal statute, the Older Americans Act, the requirement for coordination goes both ways. States and AAAs are required to work with tribal organizations, and tribes are required to work with states and AAAs for the Older Americans Act. The new regulation provides further specific information. So here we have in section 1322 of the regs, the requirement that tribal organizations have policies and procedures, and those policies and procedures must address not only providing direct services, but also working with the state and the AAA to facilitate the participation of older Native Americans in Title III and Title VII programs. The new regulations have nearly identical requirements for Title VI programs in reaching out to states and AAAs, with policies and procedures to be developed in coordination with the relevant state, unit on aging, relevant AAA and service provider or service providers. The Title VI grantees' policies and procedures must explain how the Title VI program will coordinate with Title III and or Title VII funded services. The Title VI policies and procedures must address how the Title VI program will provide outreach to tribal elders and family caregivers regarding eligibility for Title III and Title VII. This means the Title VI program needs to know and understand the services that are funded in that area. The Title VI grantees, policies, and procedures must address the communication opportunities the Title VI program will make with the states and the AAA and address the methods for collaborating on and sharing of program information and changes. For example, the Title VI program might keep notes on things that to share with their Title III colleagues at maybe a monthly touch base meeting. The Title VI policies and procedures must address how Title VI programs will make referrals for their elders who are eligible for Title III and how services will be provided in a culturally appropriate and trauma-informed manner. Because the state plans on aging and the area plans on aging are to include and address Native American elders and caregivers, the rule includes that the Title VI program must have processes for providing feedback on those state and area plans. As I said a second ago, we're going into more detail on state and area plans in our next Back to Basics webinar, which will be the fourth in our series, scheduled for June 27th at 2 p.m. Eastern. The rule also includes that the Title VI program director for each Title VI grantee is to participate in the development of those policies and procedures related to Title III and VI coordination. So yeah, of course, it's critical to know who your Title III partners are if you're in a Title VI program. If you're working in a Title VI program and need to find contact information for the state or the AAA for your area, simply go to the Elder Care Locator at the link on this slide, eldercare.acl.gov. You can also call the Elder Care Locator at 1-800-677-1116. And for states and AAAs, you too can get information on tribal contacts using the Elder Care Locator. You can find information on other programs to increase access to services for Native American elders and family caregivers, also on the Elder Care Locator. So moving on, the old 1988 regulations had very limited guidance on addressing emergency preparedness and response. I mentioned a few minutes ago the changing and evolving needs of the senior community, but we also see changing environmental and health threats and seemingly increased disasters. So the new regulations address that. The new provisions include new sections to support older adults and caregivers during emergencies and disasters, including those that may occur in Indian country. The new provisions include flexibilities for addressing emergency preparedness and response, and also lessons learned from the pandemic, because surely COVID won't be the last public health threat that we face. Specifically for the tribal organizations and Hawaiian Native grantees, you are required to have emergency plans that include working with the State Unit on Aging and the Area Agency on Aging, as well as with state and local governments and other emergency management agencies. This requirement for emergency preparedness and response is mirrored on the Title III and Title VII side. We have here in 1321.97 that the state agencies and AAAs will have emergency plans. And those plans will include coordination with tribal emergency management as appropriate. Where the previous couple of slides talked about planning at the organizational level of tribal organizations, states, and AAAs with emergency management entities. In this and the next slide, we'll talk about coordination among the Older Americans Act programs. 1322.37 here continues with the related requirement for states, AAAs, and tribal organizations to all work together in emergency and disaster preparedness, planning, response, and recovery. Moreover, a Title VI grantee must have policies and procedures for how they will communicate and coordinate with state agencies and area agencies on aging regarding emergency and disaster preparedness, planning, response, and recovery. Again, this requirement is mirrored on the Title III and Title VII side with the states and the AAAs. Section 1321.103 states that state agencies, AAAs, and Title VI programs should coordinate together in emergency and disaster preparedness, planning, response, and recovery. Similarly, states and AAAs must have policies and procedures in place for how they will communicate and coordinate with Title VI programs regarding emergency and disaster preparedness, planning, response, and recovery. And we definitely look forward to sharing more information regarding the Older Americans Act final rule and emergency disaster preparedness, planning, response, and recovery at an upcoming Back to Basics webinar. So now I'd like to turn the presentation over to Ms. Sonya Begay.
Hello, hi, this is Sonya. I'm not sure what's going on with my screen, with my camera right now. But if everything goes well, if I could get a thumbs up that you hear me as soon as I get the screen put up, I will do it. But anyway, welcome everybody.
Sonya, we can hear you.
Good deal, thank you. I don't know what happened to my screen, it just doesn't want to work. But anyway, I will proceed. So thank you. But good afternoon, everybody. My name is Sonya Begay. I'm the policy analysis for the Office of American Indian, Alaska Native, and Native Hawaiian programs within the Administration of Aging at ACL. I'm an enrolled member of the Navajo Nation, and I've been with the Title VI program for probably about maybe 2 years right at this point. And so it just brings great pleasure for me to bring this information to you today. So with that being said, I will continue with my presentation. Next slide, please. First, we want to start with some basics on what Title III includes and what Title VI includes. As listed on this slide, Title III is grants to state units on aging and area agencies on aging. Title III is divided into parts B, C1, C2, D, and E, just like a book is divided into chapters. Funding is appropriate to state units of aging and area agencies on aging based on these parts, and requirements that apply to each part are specific in the Act, and the final rule, Part 1321 of the final rule, covers Title III. Similarly, as listed on this slide, Title VI is grants to tribal organizations and a Native Hawaiian grantee. Title VI is also divided into parts A, B, and C, just like a book is divided into chapters also. Funding is appropriated for Title VI grantees based on these parts, and requirements that apply to each part are specified in the Act, and the final rule, Part 1322 of the final rule, covers Title VI. There are a couple of items to highlight. First, you will note a change in the regulations. The 1988 regulations had a separate Part 1322 that applied to Title VI Part A, and a separate Part 1323 that applied to the Title VI Part B, Native Hawaiian programs. The Title VI Part B Native Hawaiian program applies to only one grantee. In the 2024 version of the OAA final rule, we combine regulations about Title VI, Part A, and Part B to address them together in Part 1322 to reduce confusion and improve consistency. This does not change anything in the Older Americans Act. We still award funding under Part B to the Native Hawaiian grantee. It's just that the new regulation Part A and B are together for consistency and the ease of reference in Part 1322. Slide. As mentioned previously, Title III and Title VI provide basically the same services, but they are organized slightly differently in the OAA. This slide is a handy reference guide if you're trying to decode what the state and AAAs are talking about when they talk about Title III services. Similarly, you might use this chart to help your Title III colleagues to better understand how Title VI is organized. When someone asks about an Older Americans Act Part B grant, this table will help you figure out which title of the Older Americans Act you are talking about. The services listed in the pink, which is the 8 services on the top half of the slide, are services for older Americans and elders. These services are allowable under the Title VI Part A Indian Program grants and Title VI Part B Native Hawaiian Program grants. They are also allowable under Title III, but there are separate parts, in other words, grants for congregate meals, home delivered meals, health promotion, transportation, case management, and other services. The services listed in the yellow, or the 2 services at the bottom of the slide, are allowable under Title VI Part C and Title III Part E. As note, given various needs and the resources available, not all services may be provided with Title VI grants, and which services are provided, especially under Title IIIB, will also vary. In summary, this is one of the reasons why coordination is so important, so that there's communication about the specifics that apply to each local community. Here are some examples of Title III and Title VI coordination. Some of them you might be doing already. If not, these examples are a good beginning steps so that you don't require extensive changes to your programs. A basic principle with these examples is communication between the 2 programs. This list summarizes part of what we have been discussing in the prior slides. We look forward to hearing from you across the country about other examples we can add to this list and for further details on how you do these coordination activities in your area. In April 2024, a Title III and Title VI spring convening was held in the Commonwealth of Virginia. The attendees included several AAA programs, the state of Virginia, Department of Aging and Rehabilitation Services, and also the Title VI tribal grantees from Chickahominy and also Monacan were in attendance. The discussion included what the tribes wanted the AAAs to know and where potential collaborations exist between tribal needs and what the Commonwealth of Virginia and AAAs can do. To start the discussion of this meeting, everyone was placed in 2 groups, which included tribal members with AAAs. Within each group, the discussion included identifying needs, possible solutions, and opportunities for collaboration. Out of this discussion, several concerns between tribes and states were brought up. First, cultural differences within meetings that tribes have with states. Also, tribal members do not trust outsiders who approach them. One of the examples they had specified was there would cause barriers for completing state assessment instruments, which included asking a lot of personal questions. A possible solution that came up was basically to have a staff member of a AAA organization and the tribal staff to collaborate on visits to older adult tribal members to complete these assessment tools. With this being said, discussion moved toward the opportunities for capacity building and building relationships with tribes. The AAAs and state coordinating on the needs for state cultural competency trainings. The tribes also would be invited to attend various conferences and or sessions within their areas. An invitation for tribal members to serve on AAA advisory boards. And lastly, the tribes in attendance invited AAA staff to powwows in their neighboring areas so they could relook and see how areas and people in those areas will be into seeing the state coming to their tribal areas. Next, I will share some resources with you. You have heard earlier from Cynthia LaCounte, the Director of the Office of American Indian, Alaska Native, and Native Hawaiian Programs within the Administration of Aging. Her team is available as a resource for Title VI programs and all of you in the Aging Network seeking to coordinate with Title VI programs Our contact information is on this slide. ACL's team of regional administrators is also available to assist with Title III and Title VI coordination questions. The regional administrators work with both Title VI and Title III grantees, and especially work closely with the states as they prepare state plans on aging. The contact information for each regional administrator and information on the states and portions of the country they serve is on this slide. Finally, we have a number of specific resources on the final rule on our ACL webpage. You can find the resources at acl.gov/OAA rule. When you go to this website, you will see a number of resources. First, you can access a link to the final rule as published in the Federal Register. This website includes recordings of webinars. To date, this includes our initial overview of the final rule, the first Back to Basics webinar on stewardship, oversight, and advocacy responsibilities, and the second Back to Basics webinar on fiscal policies and procedures. Next, it also includes fact sheets, there's a 2-page overall view of the final rule, as well as more detailed fact sheets on the final rule. We just posted a fact sheet on fiscal policies and procedures, and be sure to stay tuned for the additional fact sheets we anticipate posting. We include information on upcoming webinars and trainings. As mentioned, the 4th webinar in our Back to Basics series will be on state and area plans on aging and interstate funding formulas on June 27th at 2 p.m. Eastern Time. Everyone who registered for today's webinar will receive an email when we have posted the recording and slides for this webinar. That will be in the next week or so, and that will include registration information for the next webinar on June 27th. Finally, there are other resources included on this website, and we encourage you to check them out. In general, to get information on new resources and webinar opportunities, please sign up for ACL announcements and updates. You can use the link on the slide. You can also find it by going to our ACL webpage, scrolling down to the bottom right corner and clicking on the link and the yellow box to sign up for ACL updates. There's also an email listed through the Older Indians webpage that is specific to Title VI and tribal aging programs. You are welcome to request to be added to that or contact one of your ACL points of contact for more information. As we conclude today's webinar, we want to wish you all a happy Older Americans Day month. The 2024 theme is Powered by Connections, which recognizes the profound impact that meaningful relationships and social connections have on our health and well-being. Today's webinar on Title III and Title VI coordination highlights the most important ways OAA programs promote just that for Native American elders and family caregivers. Thank you very much.
Sonya, thank you so much. And thank you to Derek and Cynthia as well for providing such a wealth of information about Title III and Title VI coordination, and doing that in a way that I found very easy to follow and to understand. And it's such a great resource for all of us. So thank you very much for those presentations. Since we do have a little bit of time left in our scheduled webinar timeframe, I did want to start working through a list that we have compiled of questions that we have already received from the field. So this could either be from tribes or tribal organizations or states and area agencies in your work in implementing the final rule that relate particularly to Title III and Title VI coordination. So I get to pepper my colleague Amy with some questions here. Amy, did you want to introduce yourself first, and I'll bring up the first question?
Sure. Yes, I'm so pleased to be here. I'm Amy Wyatt Rodriguez. I'm the director of ACL's Center for Regional Operations, which means I get to work directly with ACL's team of regional administrators like Derek, who spoke on our webinar today, as well as work closely with Kari and Cynthia and all of our colleagues in the Administration on Aging and across ACL. And I was part of the team that's been working on the Older Americans Act rule and our implementation of it.
Thanks, Amy. Okay, so how about for our first question? What resources are there for those that receive both Title III and Title VI funding so that the work can be streamlined and burden reduced?
Great question. And we are all about streamlining and reducing burden. And actually, for those of you that may have joined our fiscal policies and procedures webinar back in April, we did talk about some considerations for entities receiving both Title III through state and area agencies on aging, as well as Title VI funds, which directly come from ACL to eligible tribes and tribal organizations. And so as an example, there are 6 designated area agencies on aging across the country that are tribes or tribal organizations. And we also know there are many tribes and tribal organizations that get Title III funding from their local state unit on aging or area agency on aging. So a couple of things that we talked about to streamline and reduce that burden. So one was around data considerations, really kind of maybe thinking about that as a potential starting point to find ways to make the fiscal and associated programmatic reporting clear and minimizing duplication. We also shared a strategy that's been shared with us about crosswalking services as a team to be able to identify, again, those additional resources or opportunities for collaboration. Again, streamlining, reducing burden so that we're not all having to do the same exact types of activities. And in going through that crosswalk, being able to identify the different requirements that apply for different funding sources. So in addition to Title III and Title VI funds, there might be state funding or other local funding. Again, kind of looking at all, streamlining it and how a small tweak maybe can be made to meet requirements for multiple programs. And then just 2 other things that I'll briefly mention would be around, I already kind of said, sharing and adapting resources where they make sense. So example I'll give of that of maybe having, one flyer or resource guide that everyone shares, as opposed to every individual program having to do that or every individual entity doing that. And then just lastly, recognizing that this is an ongoing process. The education is ongoing. We have to start somewhere, but we hope it won't end. So it will continue, especially as new, hopefully, opportunities and programs emerge, maybe new challenges or barriers, but working together and continuing to educate one another is a strategy that should streamline and reduce burden.
Thanks, Amy. Let's see. The next question that we have been getting from the field pretty frequently as well is kind of related to what you were just touching on, that, starting somewhere, right? And some folks at the state units on aging or area agencies might be a little bit earlier on in their efforts to get started and really build on their Title III and Title VI coordination. So wondering what resources exist for those entities and their Title VI partners in getting started.
Absolutely. Well, and really, we are hoping that the promulgation of this final rule actually really does provide that helpful starting point and to kind of come together, and it's something new that everyone, you know, is getting newly for the first time, to be able to come together, review it, build that rapport with one another between the programs. And then the many resources that were outlined on this webinar, and again, that we will be posting. So we are hearing very positive feedback and engagement, folks wanting to do this work and wanting to get started. So we encourage really building on the prior connections, as well as making new ones. Again, kind of taking advantage of, hey, this is something new. It's a new start for all of us to be starting at the same time. And also kind of referencing, hey, here are the resources that ACL has made available. I also would encourage, you know, working with your peers, hearing about how other folks do things. If you're a Title VI program or a state unit on aging or a service provider or area agency on aging, talk with your other colleagues and see how again, you might be able to learn from their successes and things that they've done previously. And then finally, I'll just say again, we at ACL, we want to be a resource, and the colleagues, the contacts there in the Office of American Indian, Alaska Native, and Native Hawaiian programs, your regional administrators, I mean, quite honestly, any of us at ACL, if you reach out to us, we'd be happy to participate.
Thank you, Amy. And speaking of our colleagues, in Cynthia's office, I'm asking Cynthia to jump in here and provide some more information on resources to support these efforts.
Thank you, Kari. Thank you, Amy. You look wonderful today. I want to let all the states and AAAs know that tribes are coming with some really good information in under their belts, in their backpack pockets. Prior to Title VI applying, or Title VI funds being awarded, in their application, tribes are required to conduct a needs assessment on all potential clients. So on needs assessments on all their elders, and that needs assessment is summarized, and either they send the entire thing into us, or they will break it down and summarize in their application. So they have a good, some good information on the health status and nutritional needs and living conditions of each of the seniors that we serve in Title VI. And another example of how that needs assessment has been used very creatively by a state is in the state of Arizona, which is, Arizona has one of those tribal AAAs that Amy mentioned a minute ago, with the Intertribal Council of Arizona. And on behalf of Arizona tribes, Intertribal Council, and the state of Arizona have made an agreement that the needs assessment information that the Intertribal Council gathers as for our application will suffice for the needs assessment that they need to conduct for Title III funding as well. So there's good ways to collaborate like that are already taking place. And as Amy and I think all of us have said, we're always really eager and excited to share what some of those good ideas are. I also wanted, since Kari made the mistake and unmuted me and gave me the microphone, I also wanted to mention that every week Title VI programs hold what we call a chat, and it truly is a chat at 3 o'clock Eastern time. And we normally will have a presentation. We'll have a brief 20-25 minute presentation on some service or on something we need to know about, how to do their reports or Alzheimer's care or a variety of issues. And everybody calls in, we get on Zoom calls like this, and we're it's open communication, it's open mics, and they're free to ask us to help them resolve any issues and to resolve any of their questions. Sometimes they catch us off guard, And we say, oh, wow, we've never thought of that before. But that's the beauty of working with Title VI for us, is that we direct fund those tribes, so we get that grassroots knowledge directly from them. Also, once a month on Wednesdays, the second Wednesday of the month, we do a more formal webinar for Title VI. That's at 2 p.m. Eastern Time, the second Wednesday of the month. And in those webinars, we will have a presentation that could be normally 40, 45, 50 minutes, may or may not have time for questions and answers. But again, it's a really good opportunity to interact with our programs. We also send out a daily mailing, we call it a blast, because it's a blast to work with Title VI. But we send out a daily blast as our newsletter that's full of events, upcoming events, funding deadlines, some of the events we find that you folks are doing that tribes can participate in. To get on the mailing list for any of that, contact Amy. Contact any of the RAs or anyone from our office, and we will certainly make sure that you're included in that mailing list, and we welcome your participation. It's such informal discussions that it's really easy to get to know each other and to ask those questions that we're all scared to ask because we might look like we don't know the right things. So yeah, we'd welcome your participation. Thank you, Miss Kari Benson.
Well, thank you, Miss Cynthia LaCounte. I really, really appreciate that. So glad you were able to jump back on and share those resources. I think with the time remaining, I'm going to try and get us through at least one more of our questions. And so I'm going to put Amy on the hot seat here again. And one question that we get have gotten to more recently fairly frequently is that, you know, we understand that tribes may define and serve elders under age 60. How does that affect eligibility for Title III funded programs?
Yeah, that is a great question and a great topic for coordination as well. So again, to kind of explain, Cynthia mentioned to be eligible for Title VI funding, a tribal organization or Hawaiian Native grantee has to represent at least 50 Native American elders aged 60 and older who reside in the service area. And that's a requirement in the Older Americans Act, in the law. Cynthia mentioned the smaller tribes might be able to apply as a part of a consortium coming together. And we're always happy and want to encourage, especially those smaller tribes, to work with ACL. We're happy to help you understand what that entails. So while funding from ACL to a Title VI grantee is based on the number of elders age 60 and older, to be then to use those funds provided under the Act, participants must attain the minimum age identified by the tribe, by the tribal organization or Native Hawaiian grantee. And so for many of the Title VI grantees, they identify an age of elder at like age 55. Of course, you know, there's other eligibility that applies for like caregiver services or a spouse of any age, of an age eligible elder or older adult is always eligible. But generally for Title III, it's age 60 plus. And then for Title VI, it's at the age that the Title VI grantee identifies, which in many cases is 55, but it can be other ages too. And so this is an area of coordination, again, like I said, for Title III and Title VI programs. Some tribes or Title VI programs that receive both Title III and Title VI funding will use the Title III funds to serve their elders that are age 60 and older, and use the Title VI funds to serve the other elders that they have identified who are under age 60. Again, there might be other types of coordination, different types of community referrals to provide. Again, it looks different because the needs and resources are different in every community. In some areas, there might be state or tribal or local funds that could also be used to provide services to people that are under the age of Older Americans Act eligibility, or who, given limited funds, can't be served. So hopefully that's helpful. And again, reach out to us at ACL if there are any questions.
Thanks so much, Amy, and thanks for being so gracious and letting me put you on the spot with those questions. We're never quite sure how long we've got, for the webinar after getting through all of the content. So I know today we knew we were covering a lot, so we were really glad that we also had time for some of the Q&A, and we'll continue to collect those questions from all of you. So please do keep sending those in. And I also wanted to just take a moment, and I asked my colleagues here to show again how you can sign up for our announcements and updates. So that's one of the easiest ways, just to start, if you aren't already, start getting information from us on a timely basis. But do know that is also, that's one of many resources. And so also please do go to our website, check out that the final rule web page, and thank you, that's awesome, reading my mind here. And make sure you're checking that, and the recording from this webinar will be available on the website, and related information as we develop that. So please do make use of that. And with that, I will end our webinar, and thank you all very much for your attendance. Have a great day.